Welcome to the office.
Good morning.
Good morning.
How was your sleep last night?
Restless, actually.
Restless?
Yeah.
Why is that?
I don't know.
Slide forward so your feet are touching. How's the body doing this morning? What's different? Anything different today?
I don't know. Like,
Good, bad, doesn't matter. Anything different?
well, both. Both. Like, I don't, it's been so long that I've felt like normal. I don't really know what normal is. But, yeah, it feels like definitely this is better. Like when
Shifted?
I'm walking. Yeah. Like I feel like I've actually got some sway to my hips.
Let's see if you got your swagger back.
Yeah, right. But now where I feel the pain is like,
Where?
in my, like, it's kind of pinching a little bit.
In the butt?
Yeah, and then a little bit down.
But
And
not
then
here,
in the
right?
hips. No, like, but then how should I stand? Like, what is a normal?
We'll go over
posture
that
stand?
later, okay? Go ahead and walk for me. So here's the thing. Yeah, your right hip is moving better. You're going to start activating these muscles you haven't used, right?
Yeah,
So
yeah.
things are going to shift around.
Mm-hmm.
Your right pelvis got a little more movement in there, by the way, from first visit.
Mm-hmm.
We have something to compare it to also.
And I did get 10,000 steps in yesterday, but by the end, I was sore.
That's okay. Sore is fine.
Sore.
Sore is fine. Back over here, have a seat. Let's see what we got going on today. Starting at the base. C6, 5 points today. T3, T4, left side, 5 points. Hey, dude. It's changing. Cool. We're moving up a little bit. Good. Nice. Nice. Well, this one's going to be fun today. Back slowly towards me. So we were down here.
Mm-hmm.
That's fine today. We're moving up. Right there.
Mm-hmm.
So we were at the tip of the tail
Yep.
of the bottom dolphin.
Mm-hmm.
Now we're at the fin of the top dolphin. You like my scientific approach? We're moving up. Okay, let's check up top. 1, 2, 3. Right there. 4. Oh, there's the heart chakra.
Is that why I've been crying all morning?
Is that what you've been doing? You've been crying?
Well, on the way here, yeah, tearing
Yeah.
for like, I don't know, if I needed to pinpoint an emotion, it'd probably be gratitude. I feel like the Grinch, you know, when the Grinch started to shed a tear, it's like, what's happening to me?
You mean the Grinch who stole Christmas?
Yes, yeah.
Right there. Six, 4, and we're going to do the spondy. But I'm going to move up for the spondy. You ready for me?
Mm-hmm.
Nice. Let's get a tiny bit more of that. Now, let's get that nice stabilization. Now we get a flick. No, drop. There you go. Walk it off once. That was nice. Let's go face down on the gray table. Oh, this one's gonna be so much fun. We have a PRI T4. Ooh, little side slip. So on a PRI side slip T4, normally you would contact the transverse. I'm doing it as an SP contact on the opposite side first. So it's almost a PRI SP. Oh, did I say that? It's not a special, it's a specialistic. It's not L5 though. Oh my God. Uno, dos, tres. So first part, get the tissue out of the way, right on the spinous. I'm gonna spin it that way to close the wedge. That's a piece. Good. It's gonna be a nice emotional date today for you. Yeah. That's a piece. There you go. Deep breath and out. You okay?
Mm-hmm.
Can I continue?
Mm-hmm. Just took my breath away for a second.
And now you got it back. Dun, 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 dun. L4 spondy. L4 spondy. Slide up. Shasha! Shasha! Oh, this is gonna be interesting. Hi, Shasha.
Hi.
Good?
Yep.
Relax the shoulders. Oh, that's the home run. Nice. Thank you, Shasha. That was an L4 spondy actually contacting more of 5 and bringing it down underneath 4. That was kind of gangster. It's going to be really tender, okay? Jokes aside for a second. Oh man, watching this. There you go. We can walk out. It's going to be an emotional day today for you. Spicy too, huh? A little spicy today?
Yeah. Yeah. It's good. It's
Good. Have a seat. Actually, you know what? Walk with me. Walk.
Fuck.
I can go through more tissue than face paper. There you go. All right, have a seat. Oh yeah, check it out. That's 5. No kidding.
Yeah.
Different?
I mean, it still like radiates down here, but where you're pushing,
It's moving better.
yeah.
Sacrum. That was pretty cool. Alright, let's check. Let's get a little more of that T3 in the chair. Guess it's an upper T in the chair day today. Sit back for me, please. Scoot back. Scoot. There you go.
Oops, I scooted down.
drop that left shoulder for me, please. Good. Gotta come down. Just drop it down. Oh, interesting. They moved. Different, but no crack. I want crack. Walk it up, please. I'm a little jokey today, don't mind that.
That's okay.
I think they put an extra shot in my coffee. Check out her hips now. Let me tuck the back in. Looks good. Turn. Check this out. Mira. Walk, please.
Yeah.
One more time.
Yeah, okay.
You feel it now?
Yeah, rather than like
She's getting her swag back.
ready to go dance.
What's that?
Ready to go dance.
What kind of music?
Oh, well, I don't know. 70s.
70s.
Something
You talking
classic.
Bee Gees?
No, well, no, classic rock.
Okay. Classic rock. You talking like Zeppelin? You talking Clash?
No, not Clash.
What are you talking?
I don't know. Folky, mellow stuff. I don't know. It changes.
You talking like?
I used to be a Zeppelin. Yeah.
What was your favorite band?
I had so many. I just loved music. I
What's the
still
first
love
thing that
music.
comes to your mind right now?
Back then,
Whenever.
Bad Company, April Wine.
April Wine?
April Wine, Canadian. They're Canadian.
Question.
Yeah, question. Digestion,
Yes, ma'am.
but maybe we'll talk about that at another time.
This afternoon?
Yeah, okay. And then, so the nervous system. I mean,
Yes.
my nervous system has been shot, like my adrenals. How does that relate to like back and?
How does the how do the adrenals or what is?
Or
the,
even just like my nervous system, like
Well,
anxiety.
we're talking
just
two separate
frazzled.
things now.
Okay.
We're talking neuroendocrine system.
Okay.
So when you look at the endocrine system are the glands that produce the hormones. So for example, thyroid, adrenals, ovaries, testes, pituitary, all part of pancreas, all part of the or all part of the endocrine system. Okay, endocrine means the hormones are getting released into the bloodstream. Then there's what's called the neuroendocrine system, which is the neurological control of the endocrine system. There is neuroresponse to there's immune response, neuroresponse to the immune system, neuroresponse to the endocrine system. Then there's local responses, right? So let's say we get a cut right there. There's a local response that happens, but there's also the neurological response. Okay. For the adrenals, when we're looking at adrenal glands, or we're looking at, are we trying to speed things up or are we trying to slow things down? We have two systems in the body. Let's go to this chart over here. We have the autonomic nervous system chart here. This is an old one, but I think you can get the coloring. The greenish, it used to be green, the dark one. The dark one's up here and the dark one's down here. This is the parasympathetic nervous system. This used to be yellow, light yellow. Okay. The yellow is the sympathetic. Sympathetic speed things up. Parasympathetic slow things down. That's just a generalization, right? Fight or flight, rest and digest. The adrenal gland sits right on top of the kidney and it's controlled through cilia ganglion, and the main nerves are coming through that mid-back area. It can be as far down as T11 I've seen. It can be as high up as T8. And that's this part of the body here. Okay? And that's part of your compensatory area in your spine. We're not there right now.
Yep.
We're in your parasympathetics. Sorry, let me rewind. We're in the parasympathetics up top and down low. But today, we actually did 6 and 3. So we were in the sympathetics today.
Okay.
When this stabilizes, unless this shows up, I'm not going to just adjust something just to adjust it, right?
Mm-hmm.
There are times I do stimulate the nerve. Now, there is also a adrenal adaptogen that I use. It's a natural adaptogen. And what's really cool about this product is if things are too high in the adrenals, it calms it down. If things are too low, it speeds it up. And what is it doing specifically? What is it working on? It's working on DHEA and cortisol. So does that make sense in terms of the neuroendocrine control?
Yeah, I think so. Yeah.
And so again, we can start looking at, anything can cause anything, but we know major nerve supplies, for example. You hear me talk about the B button on some of my videos. That's the moody button. And that's usually either adrenals, that could be even L1, lumbars. L2, L3 area controlling ovaries and testes related to production there. But that's if we're trying to speed things up. If we want to slow things down, it can be in the parasympathetics. It could be the sacrum. It could be that spondy. It could be up top, C5, C6. And you mentioned something else.
Yeah, I have a multinodular thyroid goiter on my thyroid.
Okay, so now when we're looking at thyroid issues, neurological control first, without looking at all the other external factors, is C5, C6. And that's kind of the area I showed you on your x-ray. Okay?
So that makes
But
sense.
all of this goes back to balancing your foundation so all this stuff can start to balance out. That's key right now. Now when we look at your blood work, we'll take a look at it, right?
Yeah.
And you should have all your stuff in there in terms of thyroid. You have your thyroid panel in there. And what I may do is I may actually go through that and teach people how I read blood work. And I've been doing functional medicine for about 20 years. And I don't think a lot of people know that about me because all we're doing is cracking.
Yeah, yeah.
So, but when I started it, it wasn't called functional medicine. It was just balancing body chemistry with nutrition. And I'll explain how I look at the blood work.
It's interesting how, like a GP and a naturopath, because they'll read completely different.
Correct.
And then so on.
So I talked about it in a recent video. What is the gold standard of care or gold standard of chiropractic? And some people would say Gonstead is the gold standard, okay? But we're going to correct that. The gold standard is tailoring to the patient's needs. And each patient gets a different plan, so to speak, because everyone is unique. Guess what? Every single person is unique. You have a completely different genetic makeup than anyone else, and there will never be another one like you, or me, or anyone else for that matter. And the idea of we're designed to be in balance with nature. We're designed that way. And the body is smart. It's always striving for homeostasis. So let's take the example of the nodules. If they're producing nodules, they probably started as cysts. And we get cysts all over the body. It can be in different organs. It can be in bone. It can be anywhere. And the question is, why do we have a cyst? And, there's the what, and then there's the why. The what is the thing that is there. The why is the how did it get there. So if we think our body is stupid, then guess what? We got to kill it or take it out.
Yeah.
If we think our body is smart, then we got to ask ourselves what's out of balance that caused that to happen. Okay? And I've seen many, many, many thyroid cases in the past nutritionally and in terms of functional medicine. And it was just balancing their chemistry and things started to change for them. But am I treating a specific condition? I'm just balancing the blood chemistry and balancing the nervous system. And it just so happened that they had this, 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 and this. Make sense?
Yeah, yeah, yeah. All right.
On your back.
My big toe, that one on the right side,
Yeah.
has a lot less mobility. It's actually very sore, like right at the base of it. Oh, ow.
Yeah, you're getting a bunion formation. Go on your right side, please. It's gonna be a little spicy, okay? Let's do the navicular. First MCP. On your stomach, please.
What, spicy?
That wasn't spicy?
No. Okay. What did you say it was?
First MCP. Metacarpal phalangeal joint.
I don't know what that means.
It's the name of the joint. Sesamoid. There you go. Gotcha. Come on up. Walk it off, please. So we did 6, T3, oh sorry, C6, T4, and we did the spondy, L4 spondy today. Lots of walking today.
All right.
That should be feeling different when you're walking.
Yeah.
Good. Okay, I'll
Yeah,
see you.
the cramping, everything's gone.
It's gone?
Yeah.
See you in the afternoon.
Okay.
Squeeze. Squeeze. A little bit on the wrist. Squeeze.
How? How's my elbow?
Relax there. Yeah, we're gonna take a shot of that elbow, make sure it's not the bone.
Okay.